So we'll go ahead and lay on
Does
your
it feel
back.
calmed down back there?
Oh yeah.
Yeah.
Leg up here.
Oh, you're moving quicker too.
Yeah.
Yeah, you're
Wow.
doing a lot better.
You went back to work too, didn't you?
No, tomorrow I
Tomorrow
do.
he starts.
Okay.
There it goes.
That was
Good
beautiful.
job.
So busy.
Too bad the audio wasn't close to that. I heard that over here.
Just want to bring your knee
Good
up a little
job.
higher. There it goes. Got both of them.
That was beautiful.
On your back for me, please. Come and get the anterior dorsals. And there they go. Awesome. Good job.
All right. Well, share your story. How you doing there? You okay?
I'm a lot better.
Yeah.
Yeah.
Overall, so we're going back to work.
Yeah.
So share your story. Day one.
So my first time comes with my wife. I was very skeptical of chiropractic medicine, and my wife made me come.
Yep.
And I actually had a really hard time walking with everything. Saw you guys. You guys pretty much had a somewhat of an idea of what was wrong with me. I wasn't totally sure. I was coming here for about 2 months before the L&I process could actually get me an MRI done. We were able to get an X-ray, and you kind of had a sense of like, yeah, it's your L5 and your S1 that's
Yep.
really messed up. And I started explaining that I was having nerve problems in my back right leg all the way down to almost my ankle. You insisted and pursued L&I to make sure I got an MRI done and to seek outside help. And I thought that was really amazing of you guys, and not just keep your business within the confines of your building, but you seeked help elsewhere. And I thought that was an amazing thing, because if not for the MRI, they wouldn't have known and done a steroidal epidural to my back. And instantly between you guys relieving the pressure off my back and getting that epidural done and pushing myself to go to physical therapy, I probably still would have a hard time walking. So without your guys' help and pushing me to seek help elsewhere, other than just continuously getting my back fixed right and straight, I mean, I probably still would be coming in here on a daily basis rather than, hey, once a week.
Right.
You know, I just really appreciate it.
Did the injections, so that took the swelling and inflammation down quite a bit. You had 2 series or just one?
I have one. I have another one
Follow.
coming up probably December, because that doctor is no longer practicing there. He lives in Utah, but he comes up on the weekends or once a month to do those lineups for those epidurals. So I'm just, like I said, like, you guys did an amazing job handling my case. Like, more than anything, just handling an L&I case like that,
Right.
which was a really weird case in and of itself, and it was just awesome.
Well, so you guys understand is that no individual is exactly the same in how you take care of it and treat it with people. And so we use like conservative treatment first, we use spinal manipulation, adjustment, but then you need to collaborate with other providers and see. And there's been, 6 in 1/2 dozen where people get trigger point injections or a steroid injection, and it helps enough that inflammation and swelling goes down, but there's a process of becoming more invasive in what we do, and that was enough that now even we're able to mobilize or adjust that area a lot easier. And it was, you were in a lot of pain, and he didn't even tell you how much pain he was in. He was thinking of changing careers, barely could turn or move on the table.
I couldn't even sit up without two
No,
people helping me up.
It was
Right.
bad, and we were doing that at least for 6+ weeks. But it took a while to get you into the provider, and while we got him into the provider, we were still doing our job. And then it takes a while for these tests to be ordered, because, guys, when you get an MRI, it's not like a heart attack. It takes time to process and get in with. So it took longer, and anytime you have a work injury, it does take longer. But with the right providers, we can, definitely help the patient, or at least move it. And I'm really glad it worked out to this point.
Absolutely.
But it was definitely a tough road but we got you to this point that he's going back to work tomorrow, finally.
Yes.
You are moving on here much better.
Yes.
I will
Yes.
say, we did put him in a DME brace. I will tell you to be wearing that
Yeah,
to
no,
stabilize the
absolutely.
area when you're moving crates.
Absolutely.
So of soda pop, you know, around. So I mean, that's a tough job on that. But what would you say to someone else that is suffering with back pain, maybe involved in a work injury, or been dealing with, or not happy with their chiropractor, or happy with their provider, I should say?
Oh, first I would say come here. First and foremost, if you're having a back injury and you're not sure what the proper procedures are, I would definitely say come to your practice, because I think I'm former military, and you know, everybody knows you got to go through a certain process there. I've never gone through this experience before. I think your firm made it completely easy for me to understand the process. You guys explained everything what I need to do, as well as taking care of me, and I think that's what truly helped with the LNI process is you guys, because if not, I probably would still not be at work. And that's our whole goal here, is to get back to work.
So the other thing, he mentioned LNI, labor and industries, or workers' comp, or work injury. We see a good number of claim managers from the state in here.
Yes.
So we had another one, and we had someone that does
Yeah.
investigations, and their patients in here. You know, so obviously it says a lot when people come in and trust the work that you do in managing a case like that. So I'm Dr. David Warwick of Warwick Chiropractic and Massage, and we have Dr. Richard Whaling here. Thank you for watching and listening to this. If you need our help, give our office a call or go to our website at drdavidwarwick.com.
And thank you, William.
Yeah, I'll be a
Yeah,
returning
thank you for
customer.
doing that. I really appreciate